Record. Okay. Hello, Menno. Good morning or good evening or good afternoon. I'm not sure what the time
Afternoon.
frame is. Okay, perfect. Good afternoon for you. How's life treating you? How's everything going on with you? You have been very busy on both Instagram and YouTube, and of course the course. And congratulations on launching the Arabic course as well. I believe it's
hmm
starting really soon. Could you give us a small brief about the course?
Sure. Yeah, so I'm doing a lot more in the Arabic market, in part because we've had so many people from Arabic countries that are now doing the English course already that we also launched a fully Arabic course with Noor Saber as the host. And he can actually answer everyone's questions in Arabic. The course is written in modern standard Arabic. It's identical in content. So for people that prefer Arabic, it's, I think, a really good opportunity. And also, I'm moving to Dubai most likely around September, October. So we were already saying like we'll probably do a lot more in person together. So that's exciting.
Definitely. I can name a few people who are really happy to have you there. And I'm sure everyone's going to ask you to do content together, maybe workout videos or round table or any a type of content that the team can come up with.
Yeah, that's
And
part of the reason why I'm going to, because it's going to be relatively easy for me to establish a social network. Like I know multiple people there. There are a lot of content creators, a lot of entrepreneurs, travelers, which is really like my type of people. So I like that.
well, we really hope you have a wonderful time in Dubai. And as soon as you decide to move here, please let us know. We'll meet you from the airport until you reach your apartment or villa. We'll make sure we welcome you with open arms.
Thank you very much.
And for everyone, we're doing exercise selection part two after actually 2 years, living up to the name. And in this part, I guess in the previous part, we broke down the upper body movements and all the exercises and your recommendation for workouts in the upper body. And now in this part, we are going to cover the lower body as well as the abs, if you consider it in the lower body or not.
Mhm.
Uh, but first, before we start, since it has been 2 years, 2 long years, has your techniques or philosophy changed in light of the new studies, especially the last couple of months or years, there was a big movement towards the stretch mediated hypertrophy. Has
Mhm.
this changed your selection or the exercise selection in general in terms of upper body exercises?
There's been an absolute explosion of research on exercise selection compared to before, where the research was kind of dormant for a couple of years. And indeed, a lot of the focus is on stretch-mediated hypertrophy, or at least lengthened bias training, lengthened partials, training muscles with more resistance at lengthened positions in the stretch position. There's still debate over whether we should call that stretch-mediated hypertrophy, but there's no alternative term either, so I often still use that term. And for a lot of people, it has massively changed their exercise selection. If you look on YouTube, it's just completely different environment compared to a couple of years ago. For me, not so much. You can fact check me, so you can go back to our previous conversation for people that want to. I think that my recommendations have not changed that much. I think actually um, I've certainly not gotten everything right when it comes to exercise science and predicting the future. But for exercise selection, I think my exercises have done really well. Bayesian curls are more popular than ever. Lat prayers are more popular than ever. Leaning back during the leg extension has been validated as actually improving muscle growth. Calf jumps have not directly been tested, but there is now consensus that full range of motion standard calf raises are probably suboptimal. You want to load them a little bit more, and you can do that with calf jumps. So that's already one of the exercises that we're probably going to go into today. They overload the eccentric by basically cheating a little bit on the calf raise. You can use a lot more weight, and then with straight legs, you go down and you have a significant overloaded eccentric and a lot of tension in the bottom position. So I think that exercise will also be validated based on the current research standing. And then other than that, I've always like I didn't predict the stretch mediated hypertrophy literature, but I've always emphasized that we should have high tension throughout the entire range of motion. And if you do that, then you're also going to have high tension at long muscle lengths. So I think the exercise selection I've generally advocated for has lived up to the hype, if you will, very well. Overhead triceps extensions have also been validated now to be better than pushdowns, which I've also long advocated for. So with exercise selection, I'd actually say that my exercise recommendations have done really well. Like I've definitely have had areas too where I've been wrong, but exercise selection, it's been very, very validating for the most part. So again, I didn't anticipate stretch-mediated hypertrophy being that important, but I did anticipate, based on my understanding of how muscle grows, mechanical tension being most important, that you want high tension throughout the entire range of motion. And we now know that range of motion is important specifically because you get stretch-mediated hypertrophy. So before, we used to think that range of motion itself was what was important, and you were just more range of motion was better. And now we know more specifically that more range of motion is better, specifically when it means that the muscle goes to longer lengths. If it's only increasing the range of motion at short lengths, it doesn't actually seem to be that important. But when you're squatting deeper, lowering the bar further during a bench press, going down more during a chin-up, really getting that full stretch in the bottom position, that's what's causing extra growth. And extra range of motion at the top doesn't seem to be that beneficial.
Indeed. And I believe the stretch-mediated hypertrophy, at some point, it was taking over the full range of motion. And I believe at some point, some studies came to show that if you stick to lengthened partials, you can actually acquire gains as much as full range of motion. What is your take actually on those studies?
Mm-hmm. Yes, that is still to be determined, if you will. There were two very influential and solid studies showing that lengthened partials might actually improve muscle growth compared to doing full range of motion training. Now, there were a couple other studies too that seemed to suggest this, but they were really poor. Really, the studies that were very influential for people were Warnke and Pedrosa et al. And they studied calf raises and leg extensions. Now, what do those exercises have in common? Both of them underload the lengthened position a lot. So most leg extension machines, this depends on the machine, but like the average leg extension machine is very difficult at the top and easy in the bottom, right? So most people, they fail at the top, and at some point you cannot get full range of motion, so you cannot kick your leg up all the way anymore. And then but you can still kick it up to here, and afterwards you can kick it up to here, and then here and here. So if you only do the first half of the range of motion, most people can use substantially more weight. And we also saw that in that study, that they could use a lot more weight than the full range of motion group. Now, under those conditions, when you have an exercise that is specifically very easy in the lengthened position, I think lengthened partials might make sense. For other exercises where that is not the case, like squats, bench presses, I highly doubt lengthened partials are going to be significantly superior to full range of motion training. And indeed, after those two significantly novel, almost revolutionary studies, most research has found that the differences are insignificant. There have been like 4 good studies on trained lifters, which is also another consideration. The research up until that point was all in untrained individuals, which of course may not fully represent trained individuals. And indeed, in trained individuals, basically every study so far has found no significant differences between full range of motion and lengthened partials. So I think that was one of those cases where the pendulum swung maybe a little bit too far in another direction. It was like full range of motion all the way, and then it was like, no, range of motion is irrelevant, just go with lengthened partials. And now it's like, yeah, I think full range of motion is important because you include longer muscle lengths, and it's important that you have high tension at long muscle lengths. If your exercise is very poor at loading the muscle at long lengths, it might make sense to lengthen partials. But I think just using a full range of motion and getting the maximum length change during the exercise that you can is the most important. And lengthened partials for certain exercises might be superior, but they certainly haven't lived up to the hype of the initial studies.
So initially, we don't have a ruling that says, okay, let's stick to lengthened partials. I guess up to today, I guess team full ROM wins at the end of the day.
Yeah, I would say that, you can make the case that lengthened partials have also never been shown to be inferior. So you could make the case, in some research they're better, in every other study they are the same. So you could just do lengthened partials, I guess. The issue I have with lengthened partials is not that I don't want to change my view from full range of motion. It's that lengthened partials are very difficult in practice to implement progressive overload for. So if you do a leg extension, you usually have a pretty good idea of like the leg goes horizontal and then the rep counts. If you're doing half a rep it's like, what exactly is half a rep? It's very difficult to monitor, you know? It's like in a powerlifting competition, parallel depth for a squat is kind of clear, but it's already controversial. But imagine we had powerlifting competitions where we said half squats. Oh, it would be a nightmare to rule that. So that's basically what you're getting into if you're going to do half reps in your own training. Certain exercises you can do that with, like chin-ups. You just go until your upper arm is horizontal. That you can do it. But leg extensions, very difficult. Leg curls, also very difficult. Many exercises just become very problematic. And my experience is that many people just don't like doing only length and partials. Full range of motion training is easier, in part because there's a very clear endpoint. You should do as much range of motion as you can. You kick the weight all the way up. You pull yourself all the way up. It's much more clear.
Something I added to my exercise selection recently is not exercise selection, but I would say on the way I structure my exercise itself. I sometimes go for the last set of my exercise. If I finished, for example, let's say Bayesian curls, when I finish it, I try to, for example, I reached a failure at 8 reps. I try to add lengthened partials as an let's say it's like post beyond failure reps. Like I would say 3 post-failure reps of lengthened partials. Um, Again, it is unclear if it's this rep itself is standardized in those 3 reps, but it gives me that extra pump, I guess, and of course it doesn't mean that it's gonna grow muscle, but it gives me that kind of a nice feeling during the exercise itself. I'm not sure how
Mhm.
scientific this is, but it's just it hits that spot in my bro brain.
Yeah, yeah, and that's becoming a lot more popular, and it has been validated in research. So we know that at least for calf raises, if you finish your set, one group trains to failure and the other group trains to failure, and then keeps going with half reps, they actually grow more muscle. And it's simply because you do get the volume. It's still effective volume and with the same weight. So if like a drop set, there's less tension because you have to reduce the weight. But in this case, it's the same amount of mechanical tension on the muscle fibers because you don't have to reduce the weight. You can still do half reps. So you get less time under tension per repetition, but it's still the same mechanical tension for more time. So it's quite effective. The only issue I have with it is that the stimulus to fatigue ratio is probably inferior. That's the case for almost all of these advanced techniques, drop sets, rest pause training, lengthened partials. Lengthened partials, maybe not, but lengthened partials post-failure, yes. So anything that's post-failure, we know that certain motor units have already been exhausted. They are no longer recruited afterwards. And after that point, you are getting a lot of fatigue, but the stimulus for muscle growth is not as linear anymore. Your body kind of gets the hint at a certain point, and if you just keep trashing the muscle, the fatigue accumulates faster than the additional stimulus for muscle growth. We also see that when you hit complete muscle failure, we see that in research studies, it takes significantly longer to recover from that workout, but the actual additional muscle growth is very small. So you do get additional gains, but the recovery time is a lot higher. So if you're on a low volume program, like Mike Menser, high HIIT training and stuff, you can do those things and it's just better because you just get more gains from every set that you do. But if you're doing like high frequency, high volume training, then you want to be very careful with those techniques because it might make it impossible to recover. And if you really want to squeeze out like as much productive volume as you possibly could, it would probably be better to do an additional set, like rest a little bit and then do some lengthened partials as your last set, for example, rather than do it after you hit failure within a set.
I guess it worked out for me so far because I usually do it after, for example, if I have a chest workout structured, I would avoid doing it on that exercise. Otherwise, I'll do it on the tricep exercise, for example. This way, I won't hinder my chest exercise, or
Right.
the fatigue will not carry over to the triceps exercise. So I would push it to the last set of a tricep workout, making sure I'm not gonna use this muscle in any other exercise afterwards. And it works out because my plan is a full body plan. So I guess it works out at the end. But
Mhm.
yeah, it's very interesting to know that these studies has been there and it has tested those things. It's good to see that. It's interesting that we see it's always the calf muscle that gets tested on every new. You mentioned a couple of studies now, and they're both on calf muscle. Is there a reason
Yes.
for that?
Yes, there is. There are certain muscle groups that are a lot easier to ultrasound, to MRI, and to train. And it's also for individuals, things like, for example, the glutes. Mostly women that care about the glutes. But then you have the issue especially if you have male lab assistants, you want to ultrasound the glutes, so women will say like, oh, why don't we have more research on women? It's like, well, that means there would be a guy with electrodes and ultrasound imaging working on their glutes. So that's an issue. And then there's also the issue that the ultrasound mechanically, like technically, is also much more difficult to do on gluteal muscle than on a muscle like biceps, triceps. Pecs are okay, but especially the muscles in the limbs are very easy because you can kind of ultrasound throughout the entire limb. So you have those issues, like the ethical issues and the technical issues. And then also certain muscle groups are just very easy for people to learn the exercise for, which usually means, again, the limbs, like chest or back muscles or compound exercises harder. Everyone can do a calf raise, everyone can do a leg extension. There's also very little technique. So leg press, leg extension are very popular in research because you can get a bunch of people to the lab and it's just like, okay, the machine goes from here to here and that's it. And then there's very little that people can mess up. Maybe, they could injure themselves or something, but for the purpose of the study, at least, compared to a squat, it's a lot easier to standardize everything. So there are a lot of these practical considerations that indeed make it the case that certain muscle groups get studied more than other muscle groups. And on top of that, when that is already the case, as it is, research often wants to replicate another study to see if this is true, or like they build on another study's results to see if, okay, if this, then what about this? And then if you use the same muscle group, it makes sense because you have the exact same conditions. But if you were to replicate the study with a different muscle group, and now you're doing lengthened partials on the latissimus or something, then it's like, okay, is the result from this study different than the other one because it's testing a different muscle group, or because you changed the study design? So then you would again have to do a new study, technically, to see if it's also the same for the latissimus, and then try whatever new thing you were testing. So those are the reasons why we see that certain muscle groups get tested all the time and others barely at all.
Well, that's really interesting to know. That's some new information for me. Okay, let's not dwell on this topic and get to the chase of our title, actually. Okay, so exercise selection on lower body. Let's kick things off with the ab muscle, or the abdominal. How would you structure the exercise on abdominal muscles, and would you treat them differently, like the upper and the lower, or would you just structure one set of exercises for the abs? And in addition to that, are you one of those who say, okay, those muscles, specifically the abs and the Erector Spinae, they work in other exercises, like the squats, for example? Would you say avoid them and wait for the compound movement to move them for you, or just structure an exercise for them?
That's a good question. I think for the abs, what you have to realize is that if you want to train it, it's just like any other muscle group. So you want to train it with a similar volume, similar frequency, similar exercise intensity, everything. You want to train it over its full range of motion, get a lot of tension, lengthened positions. All of those things are probably true. However, the question with the abs is primarily, do you actually want to train them? Because if you train your abs with the idea, this is going to get me a six-pack, that is most likely not the case. A six-pack is primarily the result of being lean enough. Most people have a six-pack. The only question is, are you lean enough to see it? Because there's a lot of fat covering it for most people. You have to get very, very lean to show the six-pack muscle. Now, the more muscle there is, the more it pops, the easier it is to unveil it, and you don't have to be as lean. However, what happens when you train the abs is that it's impossible to isolate the abs, the rectus abdominis, from the obliques, which are the muscles at the side of it. And if you train the obliques, they, just like any other muscle group, like the abs, they will hypertrophy, they will get bigger. And that means that technically your waist is getting bigger. So you are increasing your waist size. Now, for some people, that's not an issue. Like some people just don't have great ab genetics. They need to train their abs to really make them pop. Otherwise, they just kind of look like emaciated. Like they get lean and you sort of see the abs, but not really. And they need to train them to make them pop enough. For most people, though, if you have decent genetics for muscle growth, if you do your squats and your deadlifts, which don't train the abs much at all, but it's still enough for most people, that if you get lean enough, you will have a six-pack. So in that sense, you could argue for a lot of people, the visual appeal is barely there. You don't really need to train them. And it is a lot of extra effort for, very little visual difference. And if there is a visual difference, it does thicken the waist. I know for me, it has made about a 2-inch difference. 4 inches since I began all the way training at the start. So that's very substantial. Now, most of that is in the lower back, right? Because if you measure your waist, it's also the back muscles that hypertrophy. But there is a difference. And like as I started doing a lot of ab training with my back injury and with kickboxing, it has increased waist size a bit. So it is for some people a real consideration. And I don't want to like fear monger, like don't train your abs, you look like a Ninja Turtle. But for some people, it is not worth it. So that's basically the consideration. And because of that, usually what I recommend is, unless I really think or know that you have poor genetics or poor abdominal muscle size, I don't train the abs until you're quite lean. And then if we see like, okay, you're not going to have issues with your waist size, and we see that you don't have that pop in your six pack, then we start training the abs. And then when I do, I like crunches, cable crunches in particular, over like a Bosu ball or like a half ball. So you can really get that full range of motion, that nice stretch. I like a ball with a cable a lot because you can load it very heavily and it's quite stable. Most ab exercises are kind of difficult to load heavily enough. And then reverse crunches are also good, which is kind of similar, but you load the legs and you really focus on crunching and getting the legs below your body. So you have to do it from a bench and then really get the legs all the way below the bench and then all the way up, crunching all the way up and crunching the abs together at the top. I like those exercises a lot. And for most people, that's really all you need to know for training the abs.
Mm-hmm. And for both exercises, they train the same set of muscles. They don't have to be together in the same program. You can just stick to one and that will be sufficient for you, unless you're bored and you can add the other one. They don't target specific muscles on the abdominals.
Yeah, there is a slight difference between upper abs and lower abs. There is some regional differentiation according to some studies, but other studies find that it's insignificant. So it's probably a very, very small difference. Exercise selection is probably beneficial to some degree. When you get to doing like, if you're doing 20 sets of abs, probably you don't want to do 20 sets of the same exercise per week. So it's good to have some variety in there, but the regional differentiation of the abdominal structure, regional hypertrophy as a result is very, very slim. So you really don't need like tons of different exercises, which is good because it's actually very difficult to find enough ab exercises if you don't have machines for it that you can load heavily enough.
And for anyone to see the abs, I guess of course it depends on the genetics, but would you specify a specific body fat percentage that you would expect to see visibility on the abs? And if you don't, I guess it's time to add more volume to your abs.
Yeah, so this is a bit of a red pill moment for people. At 15% body fat, you should see your abs as a muscular guy. And most people think like 10%, and then you see the abs. That's at 10%, you have like a shredded six pack. Even when not flexing, probably you have like full six pack. And then when you flex, it's like shredded, like real six pack, like for the movies. So and then when you get leaner than that, you get like the really grainy type six pack. But at 10%, it's a real six pack, like 300 movie type six pack for a lot of people, if you're muscular enough. And then 15%, you have like kind of four pack when flexed kind of look, or like five pack where the bottom abs are kind of like one big chunk and the top part is a four pack. But a lot of people think that at 15% or so, they shouldn't have any abs. And the reality is that most people just dramatically underestimate their body fat percentage. So most men in particular, most men and more men more so than women. But men usually, whatever they think they are, you have to add 5%, sometimes even 10%, and that's their real body fat percentage.
For me personally, at some point I was heavily exercising my abdominals, and I think I was around that body percent when I started. Not started. It was actually good visibility on them, and I would say it was definitely around 16 to 14% body fat. That's for my experience and my genetics, at least.
That makes sense.
And okay, so I guess we covered the abs. Let's move on to the Erector Spinae, actually, since it's very closely tied together with the ab. Would you take the same approach with it, or do you have a different technique for it?
Yeah, Erector Spinae are also a muscle group that's very different from other muscle groups in the sense that the considerations are different. It's the same in terms of if you want to train it, you want to train it with a full range of motion. So you actually want to do like back extensions or something, getting into a stretched position, which means a flexed spine, and having high tension there. But with the Erector Spinae, there is the issue that a back injury, like a spinal injury, and I've had a really bad one myself, is very, very, very nasty because it just affects everything in life. The spine does heal very well, but it takes a long time often. It's about 80% of people get debilitating back pain in their life at least once. And if you really mess it up, it can become a permanent issue. And it's not like you have any relief from it. You know, if you have an elbow issue, you don't train your arms, usually it's not a big deal in your daily life. But a significant back injury just hurts every day. And it is much more debilitating in that sense. Also, there's a much more mental component to it. So for a lot of people, having a big back injury, especially combined with the fact that the Erector Spinae are not like most people's top priority in terms of aesthetics, is a questionable risk reward. So for most people, I don't train the Erector Spinae with like maximal volume. I'm a little bit more conservative. I train it with enough volume that it should grow. And you should get like that nice, you know, the double anaconda look on the back or the Christmas tree if you're lean enough. But really maximizing like every gram of muscle in the Erector Spinae, for many people, I think it's not worth it because of the added injury risk. Like for any body part, if you push volume up to your maximum recoverable volume, you're gonna have a higher injury risk. That's just the way it is. So for the spine, that I think that it's that is often not worth it. So I'm a little bit more conservative. And when it comes to flexion exercises, when I include those, usually I again make sure the volume is not too high and I do high repetitions. Because high repetitions with a very controlled tempo is generally very easy on connective tissues. So the risk reward is a lot more beneficial in that case.
And you'll add the volume to it as well without the added risk to it. One thing I think regarding the lower back muscle is that people tend to think that wearing the lifting belt is going to protect them from injury. And
Yes.
this has been something we've been saying for a while, that it's not going to protect you. If your technique is bad, the belt is not going to fix anything. You're still going to get the injury. And
yes. Yeah,
so,
it might be worse even. Because the belt allows you to use more weight. So if you do get into like a bad movement or something, and just the stress itself is probably going to be a bit higher, because most people, if they use a belt well, you can use up to 10% more weight for squats and deadlifts. That's substantial. That's extra pressure on the spine as well. So it might even increase injury risk a little bit. And there is some risk indeed that injuries that occur when people wear a belt, at least in factory workers and the like, the injuries are more severe. There's some research from Stu McGill on that. So it's definitely not going to save you. And if anything, it would be slight additional risk. Also, there is a risk that when you rely a lot on a lot of spinal flexion and you don't want to do this, the belt incentivizes you to rely on that even more, because the belt will provide more tension when you flex. So it kind of encourages bad posture, or at least posture that might be riskier, especially if you're not used to it. So yeah, belt definitely is not something that you can rely on to, oh, I'll use whatever technique, whatever weight, whatever volume. I'm just going to use the belt and it will keep me safe. Absolutely not.
Is there a time and place for using a belt actually that is actually beneficial somehow?
The main benefit is simply that if you are a powerlifter, and you are judged based on the amount of weight that you lift, then of course the belt is beneficial because you just can lift more weight. And you can also learn to lift with a belt. It's technically like a slightly different movement pattern. So you have to learn to also train with it. And then you use it in competitions and you can squat more and deadlift more. But I don't think that the belt will do anything for your gains. We know, for example, that ground reaction forces are the same. Muscle activity levels are basically the same. So there doesn't seem to be any added benefit. The additional weight that you can lift is because of the added force transfer. This is difficult to understand for some people, but imagine a hockey stick, at least a European hockey stick or a tennis racket. It's very hard, right? The tissue is the material is very hard. Now imagine that the hockey stick or the tennis racket is made of rubber. Now, if you hit the ball or the puck, it doesn't transfer all the force to it because the rubber bends. That's basically with the spine. So the spine, when it's rigid, so when you have a belt around it and it's increasing the intra-abdominal pressure, more of the force that you put into the ground is carried over into the bar because the spine is very rigid. There's very little loss of force along the way. But when the spine is kind of loose and you don't have good core stability, then some of that force is lost as during the force transfer, some of the vertebrae, they compress and they move a little bit and the spine bends a little bit, just like a rubber tennis racket.
Well, that's really interesting terminology to use. And I guess same goes for any type of wraps that add pressure to a certain point. For example, the knee wrap, the wrist wrap. I get it. You can follow the same principle, and it's not going to protect you from injury. However, it will allow you to push a little bit more weight. So use with caution, I would say.
Exactly.
Okay, now to the one of the meatiest muscles in the human body, the quads. So let's begin with breaking down the quads and how you would structure an exercise plan around those muscles to target all parts of it.
The quads are indeed the meatiest muscle in the body. They're on average the biggest. They're bigger than the glutes on average in people. Of course, it depends on which you train more, but on average in an untrained individual, the quads are the biggest. And they're really big. It's like, the sweep, the entire front part of the leg is basically all quads. Even the sides is mostly quads. And it's a relatively simple muscle. It just extends the knee. So for most people, if you do a lot of squatting, a lot of leg extensions, you train most of the heads. What you should know is that the middle head, the rectus femoris, it's very often neglected because it's also active at the hip. So during squats and exercises where there's hip flexion and extension, specifically for hip extension, the rectus femoris will not be fully engaged because it would basically be pulling you back down. It would be flexing the hip and would be pulling you back down into the squat. So the body does not recruit the rectus femoris doing squats, leg presses, lunges, etc., or at least not fully. During a leg extension, because the hips are fixed, there's nothing going on at the hip, the rectus femoris can contribute fully, and therefore, funny enough, a leg extension is technically a more complete quad exercise than a squat. And we do see in research that you get more growth in the rectus femoris. So leg extensions are great isolation exercise. The issue is that most machines are not so great. So like we talked about before, the range of motion is often not full. And even if it is, the tension in the bottom position is not great. So what you can also do is things like reverse Nordic ham curls. Those really overload the quads at long muscle lengths. Sissy squats, Spanish squats, hack squats, those are all great. For a lot of people, though, they can really mess up the knees. So I like to have controlled tempo, high repetitions, be careful with the volume, and throw them in sporadically. And then often I do still like to use traditional leg extensions because they're just very well tolerated by many people. Funny enough, there used to be this craze that leg extensions are bad for the knees and stuff. Research does not confirm that at all. In fact, if you just look at how often people get injured during a leg extension, it's really not often, whereas tons of people get knee injuries from squats. So just because it's more natural or whatever doesn't mean it's necessarily safer. And then other than that, you have a lot of flexibility with step ups, lunges, different types of squats and everything that you can do for the quads.
And of course, and for me personally, because at some point I suffered also from a lower back injury. Leg extensions were the best exercises you can do if you have a back injury. You can just sit on there and just move your knees and extend them, and you don't have to worry about your back. Especially that a lot of leg exercises, or let's say quad exercises, really depend on having a stable core and a stable back. And having leg extension, and it was magical for me at that stage.
Yeah, and as we mentioned earlier, by the way, sorry to interrupt. When you're doing leg extensions, and I've also done tons when I had the back injury, you want to put the backrest all the way back in most machines so that you lean back and you're really like doing the leg extension with as much backward lean as possible. Research has shown that improves growth in the rectus femoris even more.
And there are many machines that specifically made for leg extension. I guess you can use this as a main rule to push the chair all the way back. And just make sure that you have where the weight and the seat connect to be parallel to your knees. So you have the exact center of rotation as around your knees, so it can be comfortable and easy for you and to have maximum benefit from the exercise itself. Okay, and one last question regarding the actually, I think we can push it to the glutes. I have a question regarding the leg press and the squat. So let's move on to the hamstring and then the glutes. So we can have the end of the call to dedicated for the glutes. Okay, hamstrings.
Hamstrings are more complicated than the quads because of the different muscle functions. So all of the heads, funny enough, just like with the quads, where people have the idea that compound exercises are like the most complete. For the hamstrings, leg curls train all the heads of the quads or the hamstrings, but something like Romanian deadlift or hip extension does not train the short head of the biceps femoris of the hamstrings. So technically, leg curls are actually, again, the more complete hamstring exercise, even though they are more of an isolation exercise. You also train the gastrocs of the calves, by the way, and you get basically free calf volume if you curl your toes up as much as possible. So technically, you dorsiflex the ankle. Most people intuitively do that, but if you do it a little bit extra, you involve the rectus or the gastrocnemius extra, and yeah, you get that extra calf volume, which does not reduce growth in the hamstrings. So leg curls are great, all types. Researchers found that on a one-to-one comparison, seated leg curls grow the hamstrings more than lying leg curls because you stretch the ones at certain heads that cross the hip, which is all of them except the short head of the biceps femoris. So you get more growth, but you probably don't have to do all your training at long length. So if you do something like Romanian deadlifts, and then your second exercise could be lying leg curls, and I like to do those unilaterally, which usually you cannot do in a seated leg curl. So it helps for symmetry, balance development, for example, and there's something called the bilateral deficit. So I like to have at least some unilateral exercises for most body parts in there in general. So those are all good. You can also do the bodyweight versions like glute ham raises, even like if you don't have a lot of equipment in a CrossFit box or something, you can do like suspended leg curls, hanging leg curls. I have a video of like a lot of bodyweight leg curls on my YouTube. Those can all be useful. And then I really love Romanian deadlifts. It's just, they're an amazing exercise that trains so many muscle groups at the same time very effectively. So I love those. If you don't want to train the back and you specifically want to train the glutes and hamstrings, then hip extensions are great. If you're a beginner, you can do pull-throughs. Most people become too strong for those, but pull-throughs are also great. Don't load the spine too much, and great for the glutes and hamstrings. So some combinations of hip hinges and leg curls is usually what you want. And you probably want both, not just for the different heads, but also some research finds that the hamstrings are complicated enough that there's actual significant regional hypertrophy. So it seems that leg curls grow the lower hamstrings more, and hip hinges grow the upper hamstrings more, which some people also feel they get like that soreness just below the glutes.
Mm-hmm. And one thing that actually confuses me with the hamstring exercises, Romanian deadlift and stiff leg deadlift, are they the same or are they different exercises?
Yeah. So a lot of people, the terminology isn't very consistent in fitness. You know, there isn't like an official body that says like, this is the stiff leg deadlift, this is the Romanian deadlift. But the way that the exercises, which they are most logically interpreted in my mind, and that they have been traditionally used, is that a stiff-legged deadlift has your legs stiff. So you keep your legs straight, as the name suggests.
Mm-hmm.
And during a Romanian deadlift, you allow the knee to bend. So you push the hips back, and you don't think of bending the knees, but what happens when you push the knees back is that your upper legs, they kind of go back like this because you're pushing the glutes and hips back. So you don't keep the knees stiff. If you do keep them stiff, it's a stiff-legged deadlift.
Okay, that's good to know. And especially with the hamstrings, it's one of those muscles that if you move the knees and the hip at the same time, it will not have any volume on it, and it will not have actually any stress on the muscle itself. So squats, leg presses, those exercises are not volume towards the hamstrings at all, and it can be actually tested if you do a fist, and then your fist is going to be strong at this position. However, if you bend it towards this position and try to make another fist, you can see that it's weaker. So this happens actually in the hamstrings itself. So squats, leg presses do not exercise the hamstring muscles.
Yes, and that's actually a great point for Also, most people's intuition of like, what do you train with an exercise? For a long, long time, people used to say, even Mark Rippetoe, starting strength and stuff, that squats are also a great exercise for the hamstrings. And many bodybuilders, they were like, just squat and that trains the lower body. They didn't realize that squats don't train the hamstrings. So that strongly goes in the face of the idea that everyone perfectly knows which muscle groups are trained when you do an exercise. This shows that biomechanics always clearly predicted squats will not train the hamstrings. And then research came in and showed, indeed, in electromyography, you don't see a lot of muscle activity in the hamstrings when they exercise. And when you actually measure muscle growth, when people do a squatting program, the hamstrings basically don't grow.
Exactly. And we have mentioned this case and also the previous call where we talked about the long head of the tricep. It suffers from the same issue where it's connected to two joints. And if you move them both at the same time, they're not going to be any stress on the long head of the tricep at least.
Yeah,
Okay.
specifically for like bench presses. So indeed, as we discussed last time, bench presses will not grow the long head very effectively.
Exactly. Now let's skip the glutes and go to the calf so we can leave it to the end. Let's start with the calf muscle. How would you
calves,
structure?
yeah, we covered it a little bit. Calf jumps, I love calf jumps. It's basically just like a calf raise on steroids. And standard calf raises are good. I like lengthened partials for those because we have direct research that the calves respond really well to that type of training. So I like to usually do like the full set, the first set with full range of motion, and then remaining sets, I do those with lengthened partials. The first set with full range of motion because it's easier to measure if you're progressing or not. Because again, with the half calf raises, it's just super subjective whether you're hitting the rep or not. So I like those more to get the volume in, but to actually measure your progressive overload, I like full range of motion, even with calf raises. And then you also get volume in for the soleus with squats and the like. So most people don't really need to worry too much about the soleus. If you do want to isolate the soleus, which is like the long head, the long part underneath, rather than the big meaty head, that's the gastrocnemius on top, you should do something like seated calf raises that essentially isolates the soleus. And if you only want to train the gastrocs, which is like the part that most people think of as the calves, then you want to train you can train those with leg curls. So those count as the volume for those.
Okay, so for would you say that you don't need a standing calf raise and doing it seated and in a leg curl would be sufficient volume for the calves?
Yeah, you could do it that way. Usually, I would say you want a standing calf raise, like calf jumps, or just any other standing calf raise. And then you get some other volume from the leg curls in your program, and also some volume for the soleus for like squats and the like. So usually you get like half-half. In principle, maybe you don't need an actual calf raise, but I like to have at least one set of just calf raises or calf jumps, because that's an exercise where we really know you're going to get like absolutely maximal tension on the calves throughout the entire range of motion. So you might be able to rely on just seated calf raises and leg curls, but generally I like to have at least like one true calf raise, like standing or straight-legged calf raise in there.
Okay. Yeah. I guess it's more complicated than other muscle groups.
Yeah, calves are surprisingly complicated for like how small they are.
Oh yeah, definitely. I guess now if anyone says my calves don't grow, just check your training program for the calves. Is it just one exercise of standing calf raises and that's it? Then check your program again.
Mhm. Yeah, most
Okay.
people just don't do enough volume either. They're like, my calves are not growing. And it's like, yeah, because you're only doing 2 or 3 sets at the end of your workout. Well, sometimes.
Oh yeah, definitely. Okay, last muscle we have is the glutes muscle. I guess a lot of people are excited for the glutes muscle specifically. It has become actually in the last couple of years a staple for female fitness actually. And as simple as it may be as just as a glute muscle, but actually it's divided into many parts. It goes maximus, minimus, medius, and there are other smaller parts of the glutes itself. How would you structure a workout around the glute muscle to target all the glute muscles?
Yeah, the minimus doesn't really matter because you don't see it from the outside. You're going to train it if you train the medius. So minimus you don't have to concern yourself with. Usually you can simplify it as just glutes, the glute maximus, like the booty from the back, And then you have kind of the glute medius, which is kind of the side booty, the booty that you see from the front. So that's how you can compartmentalize it. And then upper lower glutes of the gluteus maximus, research has not found much of a difference there. We did a study on squats versus hip thrusts, and we found that even for those, which theoretically should be quite different, there was no significant difference in how they trained the upper and the lower glutes. So regardless, you do probably want a combination of hip hinges, which can be either Romanian deadlifts or something like a hip thrust. And that has a very high active muscle tension near full contraction. And you want to combine that probably with something like squats, step-ups, lunges. Bulgarian split squats are amazing, amazingly brutal also. And those train the glutes better at long muscle lengths. So you get like high tension at long lengths. The glutes probably don't need to be fully trained at long lengths as much as other muscle groups because of their specific resistance profile, which makes them produce the most active tension when they are actually contracting, when they're at very short lengths. So for the glutes, it makes more sense to include some short length exercises in there. And our study found that hip thrusts are just as effective as squats, despite having a significantly less range of motion and not training the glutes at a long muscle length very well. So I think there is a good rationale for including both types, especially if you want maximum glute growth. If you're a guy and you don't care that much, and you're doing Romanian deadlifts and squats, that's probably fine. If you're female and you want to really maximize glute growth, then probably you want some specific exercise in there for the glutes. And you want to also train the glute medius. Most men don't care. They don't want the side booty, basically. Women typically do. So then you want to add something like hip abductions. If you really want to emphasize the glute medius and take the maximus out of it, then you want to be able to draw a straight line, basically, from your legs to your torso. So you don't want the hips to be flexed. If you're sitting in a leg extension or a hip abduction machine, you want to be kind of leaning back or even lying down. So you could do like, I like lying cable hip abductions a lot. So you lie on like a bench. If this is the bench, you're lying on there, and here's the cable stack. You put it on the leg, and you can get like really good range of motion, get a nice stretch, let the leg dip below the body even, and then go all the way up. And you get super high range of motion, a lot of tension with the glute medius muscle stretched. And that should be really good for training the side booty.
Oh, okay. Would you say so there's an abduction and there's adduction? And
yes,
would you
abduction
add? So this is abduction. Okay. And the adduction, are there any exercise or would it show visually on glute muscle if you add adduction to it?
Technically, the lower portion of the glutes might have some adduction role, but I think it's quite trivial. I don't think it's going to make a visual difference to do adductions for the glutes, especially not if you're already doing the other lifts. Adduction exercises might make sense for some contest competitors. And if you want to kind of close the thigh gap, they could work for that. But you do train the adductor magnus if you're doing any type of hip extension movement, like Romanian deadlifts or even squats. So you do train those. And then the added benefit of specifically doing hip adductions with double D is pretty small. If you're a contest competitor and you're going to be in posing trunks, showing your legs at 5% body fat, or as a woman, like maybe 12% body fat, it might make sense to train it because you actually might see the muscle definition. For most people, you really don't see it. There's too much fat on there. It will thicken the legs a little bit. If you like that look, then you can go for it. It's also a practical kind of issue because your legs end up grinding up against each other, which most muscular individuals get anyway. This means you go for your pants quicker and stuff. So there's also some practical difficulty there. But aesthetically, it's a really, really marginal benefit of doing adduction. So most people, in my experience, just don't even bother.
And for exercises like leg presses, would you say that you would count a full volume for a leg press in terms of the glute muscle, or you would count it as a half a volume?
Full volume for sure, because you get to, like a leg press is really good to stretch the glutes. So you get to like really long muscle lengths quite easily, sometimes easier in a leg press even than a squat for people. You also take the back out of it, so the back cannot be a limiting factor. So yes, I would say that leg presses are actually a great exercise for the glutes.
And in terms of, I've seen a lot of TikToks and Instagram Reels where it shows you different position of the feet in terms of leg presses. And does it actually matter in terms of leg press, or it's just in terms of preference per individual?
It's really marginal. If you look at research on differences between even front squats and back squats, which is like a much bigger difference than just changing your feet angle a little bit, there are minimal differences. Differences are not significant in terms of muscle growth. They're not significant in terms of electromyography research. And biomechanically, it's still the same muscles performing the same functions. You just change where the load is, which mostly changes things like how much are the abs active, how much is the back active, and which joints get loaded, but the muscles still do very much the same job. So it's really a small difference. And if you prefer front squats, high bar squats, low bar squats, the differences are really not major. And if you get injured from one of the variants and you prefer another variant more, then absolutely go with that one. Personal preference, I think, here is a much stronger indicator than these minor differences between, yeah, you push the legs out. And if you want to maximize specifically glute growth, then you would want to do a relatively wide stance with the knees going way out.
I guess in this position specifically, it allows you to push your legs even further down because your chest is not going to be a limiting factor in the exercise itself.
Yeah.
And for squats in general, would you say, is there like a specific width to the legs where you would put your feet? And would you say like a shoulder width or narrower or wider? What's the rule of
most
thumb
people
for
should
this one?
Probably treat the leg press mostly like a squat, which means you want around shoulder width or slightly beyond shoulder width stance. Again, for specifically for the glutes, you can go wider, but you don't have to. And most people don't push the knees out enough. So most people, just like with squats, most people think of kind of folding themselves like a harmonica, and that's not a squat. A squat and a leg press is more like sitting in between your legs. And one of the biggest cues that helps people squat to depth without posterior pelvic tilt, so without butt wink, is to really open up the legs and kind of sit in between the legs. And that also helps with leg presses. In fact, for leg presses, for a lot of people, it's even more important because the fixed position of the leg press often doesn't allow you to reach like a good level of knee flexion if you don't do that.
Yeah, butt wink also one of the main, especially whenever I start with a new client, one of the first thing we always check for is butt wink, and getting rid of those sometimes easier on some clients, but sometimes it takes a little longer on other clients. They just need to have this mind muscle connection and understanding how their muscles function and fine tuning their position until they find that perfect spot where they can squat normally in a good position and full range of motion, of course.
Yep.
And the last thing I was going to ask about is knee caving actually in squats. It happens, and I've seen a lot of powerlifters who actually lifted a lot of weight where when they push the weight up from the squat, they start to knee cave. Would you say that this is a risk factor, or this is fine and this is just a human anatomy?
Yeah, I think it's mostly natural. The traditional view on this was that there's like something wrong with you and you have a muscle imbalance. But the fact that we see it in elite athletes who clearly have super well developed physiques and perfect form otherwise, or just perfect form in general, at least in terms of lifting the most weight, it means that there's really something there. And the latest research suggests that indeed it is a natural optimization of the body to shift the emphasis to basically distribute forces between the adductors and the glutes. And actually, it seems that if you have very strong glutes, which most people say you should train your glutes more, it makes it more biomechanically advantage to cave the knees. So knee valgus is actually more biomechanically advantaged and therefore more likely to occur when you don't train the adductors and you do train the glutes a lot, which might explain, because most people train that way, why we see it and why it's biomechanically advantageous for top athletes and even powerlifters and Olympic weightlifters. Now, whether it's an injury risk, most of the current estimates say that it's really a marginal difference. If you have like massive uncontrolled knee valgus, you want to be able to correct that. And especially when you squat with submaximal weights, I think it's important that you have the technique and the motor control that you can squat without it. But if it like you're doing a maximal effort lifting, the last reps of a set, and it's like you get that little knee cave movement, that's probably just your motor cortex doing the most efficient movement, and it's most likely fine.
And of course, and whenever anyone starts an exercise, and something I always recommend for my clients, especially for those who work or work out alone or in somewhat empty gyms, always have these exercises with safety equipment around you. And you never know when something might go wrong. And especially, and it's such an easy thing to avoid, especially in squats and bench presses, and which are the most exercises where we see those Instagram reels and TikTok videos where the bar falls on someone who's exercising without having someone to spot them. If you're squatting, just go to the squat cage. And if you're doing a bench press, just add the safety bar. Or you can do a bench press in the squat cage as well. So just to make sure that nothing happens to you, make sure you have your safety around you.
Yep. There's really no reason not to. It's unfortunate that many bench racks don't have any safety equipment. It's good to have a spotter, but yeah, most spotters mess up. So safety bars are often better.
Especially even if you have a spotter, sometimes that one split of a second, that spotter is going to be distracted and the weight is going to fall on you, then it will be a disaster.
Yeah,
So,
most of the time though, they're going to start helping as soon as you're like 4 reps away from failure, and they see you start kind of grinding, and they're like, "Oh, time to help," and you're like, "No, leave me be."
Exactly. You need to have that one special, very professional spotter who understand those terminologies in terms of exercise and science.
Did you see there's a recent TikTok reel that went viral, and the girl tried to help, but actually pulled the bar all the way towards her, so it ended up pulling on the guy's neck. That was like, ooh.
Oh, that doesn't sound fun.
Yeah, no, he ended up fine-ish, but very, very difficult, very painful to watch.
Oh yeah, definitely. I guess yeah, just having your safety around you is way better than having any spotter around you. At least it will allow you to fail, and especially will eliminate that fear of going to failure or close to failure in some of those exercises, especially the bench presses and squats. I guess if you go to failure in deadlift, you can just drop the weight, which is fine for you. And surprisingly enough, not a lot of people know how to exit a squat and if they fail to lift the weight. And it's just as simple as just drop the weight behind you and just, of course, make sure there's no one behind you.
If you have a lot of forward lean, it gets a lot harder. But especially if you're like kind of in that squat morning position, you can also do it to the front, but then you have to like really relax.
Oh yeah, definitely. Oh yeah, I guess we finished all the muscles we can talk about in the lower body. And it has been a wonderful call. I've learned so much more. And just to give you the spot to conclude this call, and could you tell us about the Arabic course that's launching very soon and the date of launch, and just a breakdown on how things are going to be so people can know what to expect?
Yeah, I think by the time this comes out, you have very little time left to register. So probably you're going to post a link, I imagine, to the course. Best to check that out ASAP because it's going to launch by the time this comes out, probably in a day or two. So that's pretty much the last chance of this year, probably, to get in. If you want to do the course in Arabic, you can also still do the course in English. That there are many more options for that. But probably there's only going to be one this year for the Arabic version. So if you want it in modern standard Arabic, then yeah, definitely check it out.
And what's the date looking like for both, actually, the English and the Arabic? When is it launching?
Let me check. English has multiple options. And the next one is in May.
May.
Yeah, let me check the exact date. So 16 May is the English course, the next one. And the Arabic course, I always have to put this in a translator because can't read it myself. 4 April. So yes, that is in 2 days, actually.
2 days.
Yeah.
4 April. Okay. And I will mention, of course, on my story, the link for the registration for both. And I will add the code for registration if you want to get discount on this one. And of course, I've graduated in batch 2022, I think. I'm not sure of the English course. And it has been a wonderful experience. I cannot stress this enough. Uh, Everything I have learned in my fitness journey it was very simple and straightforward while learning the course. Of course, there's a ton of material, and I cannot stress this enough. If you want to register to the course, just make sure you read the course at every week when it launches. Some modules will give you 2 weeks of reading, and others will give you just 1 week. So, and there are each one is like 100 pages or more sometimes. I think the energy one is almost 200 pages. The protein is also a long one.
Mhm.
So it will cover everything you need to know in terms of nutrition and in terms of exercise selection, how to select your volume. And basically, at the end of the course, you should be able to become a coach. And of course, you'll get a certificate. And it's not just one of those courses that you're just going to ignore it. And at the end, you'll just do the exam and pass. No, even the exam, I remember it took me, I don't remember exactly how long, but it was above 10 hours of just sitting there, having my coffee, having my food around me, and just going through the material and answering all the questions. And the interesting thing about the questions in the final that some questions that they needed you to understand the course exactly. Like especially the questions where you have two identical twins doing different things and how the which one will build more muscle or which one will lose more weight. So you really need to understand the course and have a full understanding about the course itself. And it's a long one. I think it's
10
11
months.
months.
Yeah,
Oh,
10
11
months. Yeah.
months. Oh, 10. Okay, perfect. Ours used to be 8 or 9 before, I think.
Yeah, because we now also teach you like marketing, much more psychology. There's a lot more extra content, also on hormones, for example. So we also streamlined a lot for making things easier so that it's easier to like, if you're just interested for personal development, then it's easier to pick out the parts that are useful. And we rewrote everything so that it's easier to understand, like more summaries. And then for the people that really want to be like an elite personal trainer, like, yeah, as you said, you will learn absolutely everything. This is way more than, you get your piece of paper, you get your certificate, and you go train. No, we actually prepared serious lifters to be among the world's personal elite in terms of, or personal training elite.
And the best part about it starts with you from the beginning. Like it goes down to how you actually have to read scientific papers, and it's a whole module of how to read research papers, and all the way up to injury and exercise selection, nutrition, training, and covers all the topics you need to understand. Okay, Menno. And is there anything yet you want to share with us in terms of future plans for you, in terms of content? I believe at some point you were working on an app. How things are going with the app, actually.
Yeah, the app is finished now. It's in beta phase, so I'll also post a lot more about that soon. And yeah, it's worked pretty well, making very good progress. It's a lot harder than anyone thinks to, because our app is way more advanced than what's currently on the market, but it's really good. It's like as makes a complete training program for you, nutrition program, even a meal plan, like with recipes and everything, and adjust everything based on your progress. So I really want to make it as close to a personal trainer as possible. Of course, it will never have that personal touch and everything. So it's not going to replace personal training, but for people that are self-sufficient, serious lifters that just want like a good program and basically a coach in their pocket. It's really good. It's called the Menno Henselmans Physique app. And if you search it, you can already find it, but we're not advertising it that much yet. We're doing kind of batches and doing a lot of user testing to make sure it's as awesome as possible.
We wish you all the best in your app development and in your career in general. And really excited to have you over in Dubai, actually.
Mm-hmm. Yeah, it's
So
going to be great.
definitely let me know when you'll be here. Let's meet
Will
up and
do.
catch up, and we can talk about a lot of things.
Awesome.
Awesome, Menno. Thank you for your time. I really hope to see you soon. Less than 2 years since last time.
Yes. Yes. Probably before the end of the year.
Oh yeah, we hope to. I hope to. Thank you, Menno, and have a wonderful rest of your day.
You too.
Thank you. Bye.
All right, let me know when it's up.